Morning, Alex.
Hi, how are you?
Good. How are you?
Good. How's your morning going?
It's busy, but it's good. Yeah.
Good.
How about yours?
About the same. Yeah, it's a little busy, but not too bad.
Good.
Do you know how many people you expect on this?
I'm guessing we'll have 20 to 30 people.
Okay.
Yeah.
And do you think you want to do breakout groups with some of the stuff that we had?
Whatever you recommend,
Okay.
Yeah, I'm open. I'm open. Whatever you think is most effective. Let's see. I think we'll have somewhere in that range. I mean, I'm not sure what the sweet spot is in terms of the number there.
Yeah, I
For
mean, if we
doing
get
that.
20, it would be good too. I think breakout groups gets people at least talking and thinking a little differently.
Yeah.
So,
Good. Sounds good.
yeah.
Yeah. Are we set up? I just had this as a meeting. Is that going to work?
That's a good
I don't have
question.
this
Let's see.
I don't
Yeah.
have it as a
yes.
webinar.
Well, okay. So this would make it, well, let's see here. Let me see what we can do. Okay. So the one thing you would have to make, I don't know if you make me, you have to do the breakout rooms. I don't have that option on my end.
Yeah. I think.
And I mean, if we can't do it, it's totally fine. I can do it in a big group setting too. It's not an issue.
Okay. Maybe we just do that.
Yep.
I might struggle to get that going
Yep.
on without the
That
webinar.
is
I know how to do it in a
totally
webinar
fine.
function, but not with the meeting.
Nope, that works. And what age groups are this? Is it?
I think this group would probably be primarily high school coaches of high school athletes.
Okay.
I think we'll have some who are working with younger though,
Okay.
down to 10, but it'll be primarily 14 and up.
Okay, perfect.
Yeah.
So we'll do it this way. So this session, just to let you know, will be definitely shorter than it. I mean, hopefully, there's questions and stuff, but it'll be shorter than the allocated time that we have.
Great. I'm doing a lot of these. I find that's more effective a lot of times, right?
Especially virtually. I feel like you just start, especially people are just burnt out of this. So I'm like, well, it can be, people won't follow up or want more information, we can include it later. But.
Yeah. I feel like by the time you get to 45 minutes, people forget about the content from the first 15 to 30 minutes too, right?
Yep, I agree. Yeah.
I'm sure you do a lot of this too. So
yeah. We're starting to go back in person a little bit, which at first I was like, I'm not ready. And now I'm like, oh, I get why I like in person. Just a lot more engagement. So
right.
I like the mix.
Now, Alex, I'll do a little introduction to you when we start, just real brief, and then let you take it. But how do you pronounce your last name?
Donicone.
Got it. Just making sure. Yeah. I looked up your bio when I was just doing introduction. I saw you got your master's at DU.
I did, yeah.
Yeah. I worked there for 13 years.
Oh, really? Oh,
Ski coach
wow.
there. So
What? Oh, a ski coach. Oh, nice.
Yeah.
Yeah, I was unfortunately pretty disconnected from the actual like university setting. One, our classes were like in the in the worst possible spot, but so I didn't do a lot on campus, but I
Yeah.
did enjoy it.
Yeah, there's a lot of that there,
Yeah.
especially with master's
Yeah,
programs.
right. Yeah, it's a little
Yeah.
bit more disconnected.
Well, welcome to folks who are jumping on here with a few on. Michael, Matt. I think we'll wait until a couple minutes after 10 to get started.
Morning, Dave.
Morning, Todd.
How are you this morning?
Doing well. Doing well.
How many hours of sleep did you get?
You know, I was up six or so. Yeah. Thanks for
Wow.
asking. I was
Yeah,
up
you
for a
did.
while there. She's gassy. She's a gassy little girl.
Yeah,
Which is
that's so hard when they're having a rough time and don't really know what you can do for them.
Yeah. I don't think they remember it is the saving grace. You know, I don't remember being 6 weeks old. So, you know,
No,
it's a
but
good
still,
thing
it
because it's
crushes
no
you.
fun. It is.
Crushes
It is.
when you're in
It does.
pain.
It does. Yeah. There's no question about it.
It's hard on you.
Yeah. And Alex, just so you know, we did a group of our coaches and sport program directors did youth mental health first aid training last week as
Oh,
well.
okay.
We did that 5-hour training plus
Oh,
the 3-hour
wow.
pre-work. So a couple of those are on here now. I offered this also just kind of to catch a broader group that, you know, that was a limited number we could do that for.
Okay.
And it's a big time commitment. So this is something that most of the folks on this will not have done that, so don't worry
Okay.
about that at all. But a couple
Okay.
had done that, so we're jumping into this a lot this year. With the coach, one of the focuses of our coach education this year is how to support mental health with our athletes. So we're doing a number of presentations around this. I really like your presentation from the spring, so I thought that's
Great,
but a couple folks might be throwing out some terms here.
They
So,
they may know.
yeah.
We're here.
Yeah.
Perfect.
Yeah.
That's perfect.
It's just 10, but I'll give folks a couple more minutes to join in here before I do a quick introduction and then we get started. Well, in the interest of everyone's time, I think I will get started. I think I can just let people filter in if there's some late joiners here as well. But for everyone who's on right now, thanks for joining this morning for this content. It's the area that we're focusing on with our coaches education this fall, supporting the mental health and wellness of our athletes and coaches. This morning we have Alex Yannicone. She's the Director of Education and Community Programs at the Helen and Arthur Johnson Depression Center, University of Colorado Anschutz Medical Campus. Alex provides programs and trainings addressing mental health issues across Colorado, has extensive background in implementation and training for prevention and intervention of mental health services and education. I attended a workshop with Alex last spring on mental wellness for coaches and really thought the information was valuable for how to identify warning signs, better understand mental health and wellness, and provide lessons for how to respond as a coach. Today, Alex is going to present a shorter workshop for coaches on understanding mental health to help our coaches support our athletes. As I said, I think this is a very important topic, obviously something that's been brought to the attention of the public and the sporting world more and more this summer with the Olympics and some of the mental health challenges that some very high profile athletes made public. So I think this time is right for both coaches and for athletes to be more receptive to this and to develop some education and tools to be more supportive and effective coaches for our athletes. So thanks, Alex, for being here. Thanks for everyone for jumping on, and I'll let Alex take it from here. Thank you.
Thank you. And thanks everybody for joining today. I'm going to go ahead and start sharing my screen. Hopefully you can see everything. Thanks for the introduction. We will kind of just jump right into the content here. We have a small enough group here that if you have questions or want me to clarify something or whatever comes up, please stop me at any time. You can either use the chat or unmute yourself. We'll also have a few discussion portions of this. So if you have options to use the chat or unmute yourself, please do so as we engage in some discussions and conversations as we go. This is a pretty short presentation really around mental health. This is anywhere from 45 minutes to an hour of content on a really complex and really in-depth topic. So I know some of you may have been in other trainings or workshops where you maybe take a much deeper dive into this. And so this is more kind of the foundation of understanding mental health. If there's more that you are wanting, please let me or Dave know, and I'm happy to help with content or even resources or information to really provide you with the most information we can. But just knowing this is going to be kind of skimming the surface, but hopefully you'll walk away with at least some skills and tools and resources that you can use as a coach. So we'll go ahead and get started. So one thing that I think we all recognize is that our mental health is not stagnant. It doesn't just stick in one spot where we, are always in one state of being with our wellness or mental well-being. It's kind of on this continuum that changes depending on our experiences, our history, our lives, what we're going through. So what we all strive for and what we all want is mental wellness. This is what we want for our athletes, what we want for ourselves, where we're able to recognize our own abilities. We can deal with the stresses as they come. It doesn't mean that we don't feel stress. It just means we're able to cope with it. We're able to manage it in one way or another. We can work productively, whether that's in school or at practice or in the workplace. We can contribute to that and be able to be productive, and also be able to interact with our relationships and our communities in an effective and meaningful way. We know that there are things that get in the way of that. We don't always feel wonderful and are able to manage all of that in a very smooth manner. There's things that really can influence the way we feel. And sometimes it may just be feeling somewhat of anxiousness, or maybe we're feeling lonely, or hopelessness, or anger, or grief that we're dealing with. And that kind of falls into this mental health challenge where, we're going through some things in life that are definitely impacting our mental health, but not necessarily to a place where it may be a diagnosed mental health condition. And so that's this last one here, where we know that some things really get in the way that it really interferes with our ability to function day to day and to have meaningful relationships. And if we're noticing that impact on our mental health, then we could be faced with what we call mental health condition, a mental illness, a mental health disorder, a lot of different words that are used to focus on that. Now, we don't necessarily have, once we are diagnosed with a mental health condition, doesn't mean we necessarily have that for a lifelong impact. Some are, others aren't. But again, recognizing that we can flow in between in all of these in one way or another, really depending on our experiences, our history, and what we're dealing with in the moment. So when we think about those mental health conditions, we know there's not just one source of this, of why we may be diagnosed with a mental health condition. There's a lot of different things that go into this. One is family history. So that doesn't mean that if my mom has a diagnosis of bipolar that I'm automatically going to have that as well. But when we do look at family history, we do tend to see some kind of line there where other people in our families, aunts, uncles, grandparents, may have had mental health conditions as well. And so there is some link with our family history. Any kind of trauma can also impact our mental health, especially childhood trauma. You may or may not know that with kids you're working with or people that you're working with. So it's important just to recognize that this is something that absolutely can impact our mental health. Anytime somebody goes through a physical health challenge, we know that has an impact, same with socioeconomic factors that people may deal with. Thinking about any kind of abuse or neglect, substance use, and we even see that as young as middle schoolers at times. Any kind of big change or transition, so moving or a lot of stress with school or parents, that can absolutely impact our mental health as well. So again, not necessarily one cause, but there's a range that can really happen here that can impact somebody's mental health. The one big problem that we have with mental health is that there's a lot of misconceptions and misunderstandings. These are just a few we're going to briefly touch on. But one that we do know that we hear a lot is really what being diagnosed with a mental health condition means. In a lot of instances, when we hear of something tragic happening or some kind of violence happening within our community, something that's often highlighted is, well, what kind of mental health condition did they have? And although that may have had an impact, we don't ever hear the other side of that. And what we know about people who have diagnosed mental health conditions is that they are 4 times more likely to be a victim of violence than the general public. So we need to be looking at both sides of this to recognize that those who have mental health conditions more often are the victim of violence than the other way around. We also know, and I think we all here know this, that we don't choose to have a mental health condition or a mental illness. It's not a personal weakness. Just like any major illness, mental health conditions is not the fault of the person. It's caused by environmental and biological factors like we just talked about, not just by personal weakness or necessarily choice that people may claim that it may be. We know that biochemical processes and circuits, as well as basic brain structure, really do play a role in this as well. So same way we think about physical health, we can think about our mental health as well. And then also thinking about mental health issues are not always lifelong. There are chronic mental health conditions. So you take something like schizophrenia or bipolar, those do tend to be more chronic mental health conditions. But then we know that anxieties and depressions, those are things that people can experience and then maybe not have for a while, and then maybe experience later in life, or maybe never experience it again. So there's not a perfect formula to understanding the different complexities to mental health. But the important thing is that a mental health condition does not necessarily define or does not define a person and who they are, whether it is chronic or a short term. So we really want to be looking at the person and really look at how the mental health condition impacts them, but not making that who they are. So quickly, we're going to watch a short clip talking about, what would it be like if we talked about physical health the way that we actually talk about mental health.
Listen, I know you're sick and all, but Are you even trying to get better?
Hey, look at it this way. There's plenty of people out there that have it worse off than you do.
You need to stop focusing on all the bad things in life and just try to enjoy it. It's all in your head.
I don't think you need to be taking medication every day just to feel normal. Don't you think it's changing you?
Listen, you really just need to suck it up. Like, everybody goes through this and you're just feeling sorry for yourself.
Why don't you just go to the doctor?
I can't. My insurance doesn't cover the flu.
Steven!
Man, that's broken. You need to see a doctor.
Seriously, I'm fine. I can get better on my own.
So although it seems ridiculous when we view it in that sense, and obviously those aren't things we would ever say in situations around physical health, unfortunately, those aren't uncommon statements that are made around mental health for individuals who have experienced mental health conditions and the interactions they've had with others. So just kind of a quick snap and to look into, it does seem, ridiculous and something that we would never do around physical health. And yet it's something that we do here around mental health. So how can we change the way we talk, change our language, change our approach to mental health, and really have it more mirror the way we talk about physical health? So thinking about that a little bit more kind of in the work that you all do, thinking about, kids that you've worked with, parents that you've worked with, what differences do you see in support with somebody who maybe has a knee issue versus depression? And what might you see that you've seen other coaches or parents do in situations like this, as well as teammates? Does anybody have any examples of, and it doesn't have to be a knee issue and depression, but just thinking about that mental health and physical health. Have you seen any big differences, or maybe you've seen some great similarities in support, but what are some things you may have noticed?
Hi, Alex, it's Blair Seymour. And I think one of the things that I've noticed is parents are a little bit reluctant to tell you if their kid has some kind of anything. It could be ADHD, or it could be depression, it could be anxiety, but they're more reluctant to tell you about that.
Yeah.
And since you can't see it, it's similar to like concussions where it's not a visible injury.
Yeah, that's a really good example, and so challenging as a coach, right? Because it would be so helpful to know, hey, my kiddo struggles with anxiety. And then you as a coach, you're teaching all these kids, or you're training and really trying to help support them the best they can, and not recognizing, because like you said, you can't see it. So you don't know, that maybe this kid's having a harder time because of some of these conditions that they're dealing with. So almost, at times parents are trying to hide that in protection of their child, but almost more of a disservice, right? Because it really doesn't give you the full picture of how you can best support them. So I think that's a great example. Anything else anybody's noticed or had experience with?
Yeah. Hey, Alex, this is Tony Urbick. I'm pretty new to coaching, but I've taught a few art classes and stuff over the last year and a half. And what I've tried to do is take some of the tools from therapy for my own boy and myself and kind of weave them into general, like normalizing, centering, like breathing before you get into something hard, and just kind of taking a moment to, okay, we're going to do this. All right, let's take a deep breath, think about what we're going to do, and just sort of, instead of singling some kiddos out and you can't ask, right? But just try and sort of normalize, like, hey, it's okay to talk about if you're not feeling up to it. Let me hear about it.
Yeah, that's a great example. And I think something that is great modeling for kids in really talking about mental health. So like you said, you're not singling a kid out. You're not making them feel uncomfortable that, oh, everybody knows now, or, I'm feeling uncomfortable about this. but really weaving in some of those mental health components that we know that even just for overall mental well-being can be really helpful, whether it's breathing exercises, mindfulness, having open conversations. And we'll talk about that a little bit later, but it doesn't mean we have to know everything, or that, like you said, we have to single people out. But when we can intertwine that into our coaching styles, we can notice that it has an impact on how kids show up, how they interact, and how they're really able to manage their conditions as well. So I think that's a great example. Thank you. Anything else from anybody? This is something we just kind of want to have on our minds as we, continue coaching and interacting with different families, different kids, and really recognizing what you may notice and how we can really be just more mindful for ourselves of how do I, interact around this? How do I have conversations? How do I make it so a kid or a parent will feel comfortable disclosing this information to me if they need to, so I can best support them? And we'll talk about what that support can look like here in a little bit. Another thing kind of just to know is this is something we see with kids. So looking at, okay, yes, we know some kids have some mental health conditions. What does that actually look like? And kind of that, under 18, we see the most diagnoses around ADHD. That's followed by behavioral problems, which they do include ADHD, but it also includes oppositional defiant disorder and conduct disorder. And that's just where we see a lot of behavioral concerns with kiddos. That's closely followed by anxiety and then depression. So those are kind of our most common diagnoses. Now, one thing to think about around mental health in general, adults and kids, is there tends to be, these numbers don't necessarily reflect what kids are actually struggling with, because a lot of kids, unfortunately, tend to suffer in silence based on whether it's support or knowledge or awareness or understanding around what they're dealing with. So these numbers aren't perfect mirror of what we actually may see or notice.
Alex?
Yes.
Todd Wilson, Ski Jumping Nordic Combined Program Director here. I'm just curious, when you look at these numbers, what is the trend? Are we seeing this trend moving north? I know when I was a kid, they didn't have these these names and these diagnoses. So maybe that's a big part of it. But I guess I'm really curious, is this something we're seeing more of? And if so, do we know why?
Yeah, that's a great question. So we are noticing more diagnoses, and to your point, mental health, even though we're still not great at talking about it, it is a lot more open conversations around it now than it was when we were kids or our parents were kids, or whatever it may be. So more of it is more kind of awareness and education of, maybe you're thinking about like my parents, like if they had any of these, their parents definitely were not taking them in to, get treated. That just wasn't the norm back then. So we are seeing an increase. Does it mean that there's more of it, or there's just more awareness and support around it? That's a hard one to really nail down. And I would say, I think overall, there is a little bit more diagnoses, even without kind of that knowledge of what past generations did, for a number of reasons. One is just thinking about what our kids are doing now. So there's this great researcher, her name's Jean Twenge, and she wrote a book and an article. Also, the article is shorter, so it's a little bit easier, but it kind of mirrors the same. But the article was called how the smartphone is destroying a generation. And I'm not blaming everything on technology, because we know technology has really great benefits. But what she stumbled upon in her research was kids are actually safer than they've ever been. They're not drinking as much as past generations. They aren't going out, like getting into trouble as much as past generations. But we're really seeing this mental health crisis. And what she was finding in her research is where that trend really started to really take an increase is when the smartphone came out. And so again, she's not saying technology is the crusher of everything. But one thing we do notice with technology is we aren't tending to have as many meaningful relationships. So our kids can be super well connected, right? They can have 1 million friends and followers on TikTok and a ton of connection through their devices, but they aren't having as many meaningful relationships, that face-to-face where we just go and hang out, like, well, going to the mall with friends. That's like, nobody does that anymore. Or just having a friend over to hang out and talk. Those kinds of things just aren't happening as much. And one thing we do know about mental health is one of our biggest protective factors or safety nets for our mental health is connection, is meaningful relationships with other people. So again, I don't want us to walk away saying social media is killing everything, but one thing we know is kids aren't having as many meaningful relationships, and that is something that we need to do better at. We need to be promoting more as coaches, as parents, whatever it may be, because that does have a big impact on our mental well-being. The other thing kind of to fall into that is thinking about information overload. So because we have great technology, we know when a disaster is happening. We know when there's issues going on in the world as it's happening. I knew nothing about politics or things that were going on, or even necessarily parties I wasn't invited to in high school and middle school. And kids get that information as it is happening. And that's anxiety provoking as adults, let alone as kids who are still developing. So just thinking about kind of this information overload and the impact that can have on kids as well. There's a lot.
Alex,
answered your question. Yeah.
Yeah, and just to interject, I think something when I think about what we're providing as an organization is this 2 to 6 hours outdoors, not on a cell phone, with their peers, doing something they enjoy, with mentors. I think I think that we could look at, that sports done well can be a protective factor when it comes to mental health. Just doing it without even thinking about the specifics, that's time that they're not on a phone, that they're not thinking about the other thing, they're not being bombarded with these messages from a smartphone, that can be a real significant protective factor in these kids' mental wellness. Just the fact that they're out there doing this within a positive environment. I'm just curious if that's something that you.
100%.
Is that true? Yeah.
100%. And that is something I actually have a slide on in itself. So you as coaches, you as individuals who are, being able to kind of in a roundabout way, really foster meaningful relationships. That in itself is a huge protective factor for kids and teens. And so that's something we want, parents to really recognize the impact that has, and then also you as coaches to recognize that as well. And at times, this also puts a lot of weight on you as coaches, that you are doing such, whether you know it or not, you're doing such great work to really help kids and their mental health. But it also puts this as you are this mentor, you are this trusted person that you may notice kids may open up more to you. They may talk more to you about these challenges they are dealing with. And that's what we're really trying to help coaches prep for, is you may be the one person that kid feels comfortable going to because you're giving them this safe environment that they are enjoying and that they feel comfortable in. And it can put you in a position where like, oh, I don't feel equipped for this. So the idea behind some of these, workshops and trainings and just understanding mental health more is so that you feel a little bit more equipped. Not that you're their therapist or, should be their provider, but you can help guide them to get them to the support they may need around that. So we'll dive more into that here in a little bit, but yeah, that's a great observation and something I think you all should be proud of, that you're part of that. So looking at kind of the statistics around this, we do see that about 20% of youth between ages 13 and 18 have a diagnosed mental health condition. We see that with those chronic mental health conditions, about half of them start by the age of 14 and 75% by the age of 25. So we do see it kind of in that either teen to young adult place that we may see those emerge. One of our biggest issues here is that people just are not getting the treatment they need around their mental health condition. So 50% of kids don't get the treatment they need, whether that's, again, around of lack of awareness or education, access to mental health support, stigma around it, a lot of barriers in place, unfortunately, that prevent kids and adults from getting access. We also see this huge issue between symptoms and treatment. So let's say I'm a 10-year-old kid who's starting to show signs of anxiety. Part of the problem around that is I'm also a 10-year-old kid developing as normal. And so sometimes we miss some of the signs, or we don't know, is this just a typical 10-year-old or is this true anxiety? What's going on? And so a lot of times we don't see that 10-year-old getting the right treatment until they're 21 years old. So this is something we as a society need to be doing a better job of really recognizing, what's going on, how can I get supports in place sooner to really help that kid or that teen with what they're dealing with. We obviously see this impacts their education, and we see higher dropout rates, higher kids getting in legal issues. And then I think most of us also know the impact that we're seeing around suicide. And unfortunately, in this, I'd say last 6 months, have really seen an increase. I think, what was it, a couple months ago, Children's Hospital came out with a state of emergency around mental health, as they've just been having such an increase in suicide attempts and concerns. So just something we need to be paying attention to. So when we look at mental health in general, we know there's a lot of kind of warning signs or risk factors that we may note. And when we talk about warning signs and risk factors, this is broad. This is not saying this is for anxiety or depression. We don't necessarily need to know the ins and outs of this. These are just things we want to have awareness around of what may be showing up, what may be of concern, that we're noticing this. Now, some of these that we talk about, kids may have, show up to practice and they're feeling one way, or you see one of these and then the next day they're totally fine. That's normal. We know kids have good and bad days, same with adults. Where these are concerning is really where we see it interfering with their ability to function. So they're not able to show up to practice or to games, or they're not performing the way they usually did because of what you're seeing or what you're noticing, and it's impacting their meaningful relationships. That's where these warning signs and risk factors become more of a concern. So thinking about warning signs and risk factors around mental health, are there any examples of you have noticed or seen in your own lives, whether it's with kids or even personal, that have shown up around mental health concerns? Any warning signs or risk factors?
Alex, it's Blair again. I have a couple athletes, one who her appearance has completely changed. She's kind of gone dark. She wears her earbuds all the time. Her outer personality, what you view is kind of, she doesn't really care. She doesn't want to be involved. She doesn't hang out with anyone. That's been a big concern. And there's another one that has started to really decline in school and is constantly on the academic eligibility list and doesn't show up for practice, and his mom thinks he's at practice and stuff like that. So
great. Those are perfect examples. So that appearance piece, and how they show up and how they interact, and kind of a little bit more, like you said, just kind of not caring. There's this kind of, who cares? Why put effort into this? And something you bring up with both of those that I think is important is it's a change, right? It's not the kid who's kind of always been quiet into themselves and that's their personality. It's this change that you're noticing, or they, have always been just average students, but actually, now they're doing poorly and they're not doing well. So those are really, really good examples of what this can look like. And to your point, have some concern as a coach of, something's maybe going on here. And so, this is not how I, sorry. This is supposed to all be in one. There we go. So looking at some of those, and this kind of falls into what you mentioned a little bit, but with warning signs, we may notice this withdrawal from relationships, whether that's with teammates or coaches. So again, maybe they had a good relationship with you, or they were really close with their teammates. And now, like you said, they just put their earbuds in, show up, do what they need to, and then leave, and don't really interact anymore or really enjoy what they were doing. That decline in whether it's academic or athletic performance, we may notice it. We may see it in the way that they talk, whether it's about themselves or the way that they kind of feel about themselves, like, I'm worthless, I'm not good at this anymore. And we hear that talk, right? Kids get down, especially when they have poor performance. But when we're really noticing this over and over, and there's no hopefulness, there's no like, okay, but I can maybe try better, or I'll practice more, I'll put more effort in next time. If it's just kind of just this down hopelessness, helplessness that we're hearing, that's definitely something we would have concern for. Also, if we see them, having this excessive worriness or fear, having a really hard time making decisions, we see these really dramatic mood swings, again, that are interfering with their ability to function. Maybe we hear or we notice substance use increasing, and maybe that's impacting their ability to show up to practice or show up to games or events that they're needing to. And then obviously, if we hear any comments of self-harm or suicide as well. So warning signs are behaviors. And again, it's usually a change in behaviors. Then we have risk factors. And these are things that, kids may or may not have, the influence to change. These are things that happen in their lives. So maybe a psychological response to, maybe they had a bad injury and they're still recovering from that. Maybe they're overtraining or they've failed a lot in their performance. And that's feeling, obviously has a big impact on how they feel. If they're having elevated stress, maybe their parents are putting a lot of pressure on them. Maybe school is really difficult for them right now. They're not sleeping as well. That absolutely impacts our mental health. Coaching style can impact this. When we see, there's a balance with coaching styles. We want our kids to perform. We want them to have some discipline and structure. But we also know there's a tipping point there where it also can have a negative impact if it's too much pressure, too much discipline that's really not contributing to a higher performance, but really lowering their performance and really lowering their self-esteem and mood as well. Anytime bullying comes up or there's any kind of disciplinary action, so maybe again, academic or, even in the community, anything happening there. Anytime they may experience a major life event, so a difficult divorce, they just moved, they lost a bunch of friends, any of that can feel really overwhelming for kids. And if they're not having this social support that they may need, maybe they are feeling really isolated, maybe they don't have a lot of friends or peers that look out for them. These are just some of the warning signs and risk factors we may note in kids who could be struggling with a mental health condition. Again, we know some of these come and go, but if we're noticing this somewhat consistently, we're noticing it's their inability to perform or to show up for practice or engage with peers and friends, that's where this can be concerning. So we're not going to go into a lot of detail here, but just to kind of look at some of the most common mental health conditions we may notice. Depression is more, and we do see kind of more diagnoses with this than we've had in the past. But this is more than just feeling sad or going through a rough patch. We see that people who are diagnosed with depression, they have a range of symptoms that can be, from sleep to kind of these emotional concerns. They may have a lot of fatigue, loss of interest, really low self-worth, and having those kind of symptoms be very consistent for a 2-week period or longer. That's where we could have concern of depression. We know kids and adults, sometimes like, I don't want to get out of bed, I don't want to go to school, I don't want to go to work. But we do it. We show up. We may not feel great. We may be exhausted, but we do it and we can actually engage. A lot of times with the diagnoses of depression, those feelings are so overwhelming and so kind of persistent that we aren't able to show up. We miss school. We can't get out of bed. It's really overwhelming for that individual. The one thing about depression that we do know is that it is treatable. We know that there's therapies that can be really helpful for some people. Med management may be part of that. One of the best therapies we have out there is what's called cognitive behavioral therapy that has some really great outcomes. But this is something that you don't need to know the ins and outs of, but just knowing that there are options for kids to get effective treatment around depression. Now with anxiety, anxiety in the US is the most diagnosed mental health concern we have in the United States in itself. We are seeing an increase in this as kids as well. We also know that we all experience anxiety. So if a kid has a big game this weekend or a big event this weekend, that makes us anxious. That's something that we all get butterflies and we may feel overwhelmed about a little bit. But usually those feelings and that anxiousness that we have makes us want to practice or put more effort towards that or really prepare for that. The difference between those kind of anxious feelings and true anxiety disorder is with anxiety disorder, it actually usually prevents us from engaging what we need to. So speaking in front of a group, they avoid that to all costs, or they have this big event or game, they don't show up for it. And so that's where we really see this concern with anxiety, where we see avoidance, or we see people, those feelings are so overwhelming that they're not able to attend to the things that they need to. Now with anxiety disorder, this is actually the most treatable disorder that we have. And again, cognitive behavioral therapy and therapies tend to be the best treatment around this. If anxiety disorders are left untreated, we do see negative outcomes around other mental health conditions, and we see an increase in things like depression and other mood disorders emerge for those who go untreated. But those that are treated, we see better outcomes, and that if somebody has been struggling with depression, that it has a positive impact on that as well. So we can do a lot with anxiety that can really help other outcomes and also help down the line as well. Briefly, just other ones that we may notice, we all hear and we know of ADHD, attention deficit hyperactivity disorder. The main thing here is this inability to control behavior. So we know kids get fidgety, stop paying attention, are a little bit more impulsive. That's normal for kids. But where we really have concern about ADHD is if we are seeing this be so consistent that it's over a 6-month period or longer, and it's really this inability to control. So if you're noticing kiddos and they're acting out, there's things that are going on, and you say, hey, you need to cut that out, or here is the consequence. Most kids kind of can react to that and say, okay, I don't want that consequence, and can focus and move forward. Kiddos with ADHD don't have that ability. And so we see them getting in trouble a lot. We see there being a lot of consequences and discipline happening because of that inability. And again, these aren't these like days that kids here and there. This is pretty consistent for 6 months or longer. The great thing about ADHD is schools and a lot of people have a lot more awareness around this, to how to support kids. So schools are doing a lot better job with this, and kids are also learning self-management skills to deal with this as well. And there's behavioral therapies that are supportive as well. So a lot of options there. With bipolar, you probably won't come across this very often, but there are diagnoses in kids and teens with this. This is a chronic mental health condition. So once diagnosed with bipolar, this is something that they tend to live with as a lifelong condition. With bipolar, we see these shifts in moods where we see them have similar symptoms to depression, and then we see them shift to what we call mania or manic, which is really where they kind of have these highs that are a lot of times reckless and impulsive, and can include unusual risk-taking behaviors as well. And they'll shift between these. With bipolar, there is great options for treatment. A lot of times we want family support. So there's family focused therapy that can be an option. There's medications, again, cognitive behavioral therapy, but options for treatment. A lot of people live very healthy, very happy lives with bipolar, with that management and support from others as well. And then the last one here, PTSD, which we've all heard of as well, which is post-traumatic stress disorder. A lot of times we just kind of focus this in on veterans, but we know there's a lot of kids who have experienced trauma. And when we talk about PTSD or any kind of trauma, it's not just experiencing it, it's also witnessing it. And so we know with PTSD, we may see kiddos react with this within a 3-month period of that event. And we can see how it impacts their ability to show up. So they may have a lot of avoidance. They may, have a lot of issues with sleep. They may have dissociation or be real fidgety or touchy with certain things. So really just noticing, if you're seeing on through something or struggled with something, how that impacts them. So again, really brief overview of some of the common mental health concerns that we may see or might come across. So we know that there's mental health concerns. We've talked about kind of the prevalence. We've talked about what we may see or notice. And then we've also talked about some of those most common ones we see. And it can be overwhelming to be like, okay, there's all this stuff going on. Well, what do we do? So we do want to think about what are these protective factors? And when I talk about protective factors, I'm really talking about safety nets. These are safety nets for mental health for kids or for teens. Does anybody have any examples of what they could think of would be a safety net or a protective factor for a kiddo?
Well, one we just learned last week in Youth Mental Health per se was positive relationships with an adult.
Perfect. Absolutely. Yeah. So trusted adults is the #1 protective factor for kids. And as I mentioned earlier, you as coaches are part of that. And you may be the one trusted adult in their life. So that is one of the biggest ones that we have. Oops, there we go. Other things to kind of note here is just thinking about resiliency. Now we talk about resiliency a lot. I'm sure as coaches, you talk about it a lot. And it's that ability to bounce back, right? From challenges, from adversity, our ability to not only manage it, but also to become stronger and to learn from those experiences. One thing we are noting with kids and teens is they aren't as resilient as we would hope, I think, in a lot of ways. And some of this, there's a lot of different things in play here, but one thing to think about is we're in this new generation of what we call the lawnmower parents. And the lawnmower parents are now the parents that mow down all the obstacles and all the weeds and challenges in a kid's way so that they have this beautiful path. They have this great path to move forward on. Now we're coming from really great places as parents in doing that. But the problem with that is that we're fixing and we're really making sure everything is wonderful for our kids and not teaching our kids how to handle those challenges or how to deal with those adversities that they're going to face at one point or another. So an example of this, a kid struggling in school, instead of giving our kids the skills to talk to their teacher and figure out what they can do, we go in as parents and say, okay, how can I fix this for my kid? What do we need to do to handle this? Or in the coaching world, right? They're not doing well in a sport, or they're not doing, not performing the way they should. Instead of giving our kids the tools to talk to the coach and figure that out, parents are intervening and trying to figure that out. So we're not letting our kids fail. And obviously we want them to fail safely, but when we aren't teaching them how to deal with struggles or challenges or hardship, and we're doing it all for them, they aren't able to cope. They're not able to problem solve the way that they need to. So that's something we really need to be working more on and really be setting our kids up to face challenges and deal with those and learn from them. Also, this idea of connection to community. So, again, we need to teach our kids what phone numbers they can call, where they can go for help, who they can talk to, how they can lean on each other as peers and what that can look like. Also, really building up, maybe they have a really deep root culture that is important to them, or spirituality. How can we, help them engage in that or be connected with that? Another big piece here is just that what we kind of touched on before, but sports and extracurricular activity, that is a huge protective factor. It gives them this place to be social and to connect with others. It can relieve stress. Yes, it can also be a sense of stress or a sense of stress, but being able to exercise, get outside, connect with others, that relieves our stress that we may be feeling as well. And when we're tired and when we've worked hard for several hours, we tend to sleep better as well. And then we learn these life skills. We learn, what it means to be a teammate. We learn what it means to fail and then to succeed. So really a lot of great benefits that we see from being involved in these sports or extracurricular activities. And then also having these positive self-care habits. So there is a balance, right? Kids, and I'm sure a lot of you have this, where kids go to school, then they go to practice, then they do homework, and they're not done until midnight. And then they start all over at 6 a.m. And that is a lot of stress for a kid in itself. So we also want them to know what boundaries and balance they can have, taking a day off, or, having the weekend to do something fun with their friends or family. Those are things we want them to engage in and not just constantly be working, because that obviously has a negative impact on our mental health. We also want to think about how we can be preventative, and think about the culture of within the world that you all coach in as well. So some things for you just to kind of think about here is, how do I lead by example? And I believe it was, I don't know if it was, sorry, I'm trying to find the name. Tony, I believe it was talking about this. I'm kind of integrating some of the things that you do just around conversations or mindfulness or breathing, being that example. So, how can I be positive in teachable moments? How do I role model sportsmanship or my attitude or emotion? That doesn't mean we're always perfect, right? We can get pissed off or angry and may not show our best selves, but those are teachable moments as well, where we say, hey, how I acted at the game last week, I'm not super proud of. If I could redo it, this is maybe the route I would have gone. Because we all make mistakes. We all don't handle situations the best we can, but those are options that we can say, I didn't do well, and this is, and I recognize this, and this is how I'm going to move forward. Because then when our kids are in those situations, then they can also say, hey, I didn't handle this well, and I can talk about it too. Obviously, safety is a big piece here. We always want to make sure not just physically safe, but also mentally safe. So, making sure that you're looking out for their safety. If you're hearing things, noticing things, talking about that as well. Sports in general tend to have a consistency piece to it, right? There's routine, there's rules, there's, behaviors that are supposed to happen, and activities that you tend to do. So really having those be well established and really taking note of those and communicating those as well. Leaning on others. So as a coach, you don't have to be taking this all on yourself. Lean on other coaches, lean on supportive parents, lean on schools you work with, whatever it may be. But don't feel like you're doing all of this by yourself, and know, that there are supports around you. Another piece here is just talking about mental health. And this doesn't mean we're, being therapists, but we can ask questions of, how do we make this team a place where we can speak openly? How are you feeling today? How's everybody doing? What kind of moods are we in? What kind of space do we feel right now? Those kind of check-ins, even though they can be small and quick, can have some meaning for kids to feel more open to talking about their mental health if concerns come up. And then we always want to encourage self-awareness and empowerment. So learn to pay attention and like in the moment awareness. So, things happen quick. We do things quick when we're coaching, and there's a lot to take in. But if something kind of triggers you where you kind of are like, what's going on here? Take a moment to have your own self-awareness. And maybe if you need to check in with that person later and saying, hey, I've noticed this, what can we do? And maybe help empower them to have that self-awareness within themselves. And again, something that you all already have established are your core beliefs and values, and just being able to communicate that is important as well. Other things just to kind of think about as we move forward, as we've talked about a lot of these, but thinking about just being a role model. The way that we show up, the way that we coach is really showing kids what we expect of them. And so the more we role model, our own self-care, our own mental health, our own physical health, the more that our kids are going to mirror that as well. Another huge piece here that we don't stress enough is just this idea of listening. It doesn't mean you're fixing everything. It doesn't mean you're knowing all the answers, but sometimes it can just say, hey, I've noticed you're having a tough day. Tell me what's going on. And you genuinely just listen to them. I mean, you don't necessarily have an answer for them, but just saying, thanks for telling me, if, let's figure out what we can do, or if you need help, let me know. But one of the things we consistently hear from people who struggle with either mental health concerns or just mental health challenges is the best thing somebody did was just listen to me. And that really helped me deal with what I was going through. So really knowing the power and being silent for a little bit, listening to what's going on and being present. Now with that, we also know that it's important to start conversations. So if you're noticing those changes, if you are worried about a kid, not just expecting somebody else to step in, you may be the only one that's noticed it. So if you're noticing that, bring it up. I'm concerned. I'm noticing these changes. Can you tell me what's happening? Is there something going on? Is there something I can do? So reaching out and asking questions can go a long way. And then also following up. Hey, I know we chatted last week. I just wanted to see how you're doing. Those little touch points make a big difference. Now, when we're having these conversations, that doesn't mean that I'm saying, hey, I think you have depression, or hey, I think you have anxiety and you need help. We never want to, unnecessarily label somebody. So we want to separate what we think, but also talk about behaviors we're noticing. Hey, I've noticed you've really been pulling away from the team, and you don't seem to really be interacting with us the way you used to. What's going on? So you're talking about the behaviors you're noticing, not what you necessarily think is going on. We can always learn more about mental health. I always recommend NAMI, that's the National Alliance on Mental Illness.org. It's a really easy website to navigate that has a lot of information on different diagnoses and how we can support somebody. And then promoting self-care. So again, this is a big piece. Kids work a lot, whether it's in school or in practice. So, having them have some time for themselves, letting their parents know the importance of that as well. And then knowing your resources, whether that's local community resources, school resources, crisis lines, all of those are really important just to have in your phone so you know who to reach out to if concerns arise. So here's just some, and I'll make sure you guys have these slides just so you can have this information. But these are different ways we can start conversations if we have some concerns. So, sometimes, as mentioned earlier, it can be hard. You don't want to single somebody out. So we can open a door of just kind of broad to the team. So, hey, I realize, we're all dealing with a lot right now. There's stress from school, families, practice, COVID, all of that. So I want everybody to know that it's okay if you're not feeling totally fine all the time. I want you to know you can always come talk to me. We also have the school counselor as a resource as well. I'll also, send this in an email or text you guys this so that you guys have, that information. So you're just kind of opening it up to everybody so that if something comes up, that maybe they feel comfortable coming to you. Now, if there is something you're noticing in a particular kid that is concerning, obviously in a kind of more private setting, it's okay to have these conversations and say, hey, I've noticed you've been showing up late and you seem really disconnected when you're here. I wanted to check in, see how you're doing and how I can help. We don't want to necessarily call kids out in front of a big group. Obviously that can lead to shutdown. So any opportunity that you may want to pull them aside or have a conversation with them in private, this can be a way that you can name what you're noticing and open that door for them to disclose what they may be dealing with. And then modeling this, we talk about this a lot, but we can say what we're struggling with to our own, what we feel comfortable with. But hey, I'm having a really hard time through all this COVID stuff. I'm trying to deal with my family and with work, and I'm struggling with it. I wanted to check in and see if there's anything that you guys are dealing with. This could be, an exercise you do before or after practice. But again, it at least gives an opportunity for kids to feel comfortable that they know that they have somebody they can talk to if they need to. And we know we get a range of responses from kids, right? We may just get a shutdown of I'm fine, it's okay, whatever. We We don't get much out of them. If there's no big safety concerns, that's okay. You can say, that's fine. I'm going to send resources. If anything comes up, I want everybody to know that they have options to get connected. Maybe you get a vague response of, yeah, I'm okay, but there's a lot going on. I don't know. I just feel off or I feel weird. We can say that's normal. A lot of us feel that way. And here's some options for help. So we don't need to know exactly what's going on, but we can give them some options to get help if they're needing that. And then they may just really open up to you. And again, this is where we can be the best listener that we can, and just say, tell me what's going on, and get as much information as possible. Now, your resources are going to be arranged, and you're going to probably have a better idea of this, and I may have Dave give some options here too. But you yourself, again, you're not their therapist. It doesn't mean they're calling you at 2 a.m. or at these different times, but just letting them know, hey, if you need to chat, I'm happy to help and be here to listen. And that may be appropriate and may be helpful. Maybe it feels a little bit, out of your realm and you're not real comfortable with that. We may want to connect them with a mental health support, whether that's a school counselor or somebody in the community, to get them connected. And then there's local crisis services that we can have as an option as well, that can connect with mental health professionals or resources that they may need. So having these resources on you will kind of guide where you need to connect and what that may look like. Definite times we want to refer is when we see problems seem to be getting worse and not improving with time. If you're noticing that increase in isolation or withdrawing or avoidance, and then obviously if safety concerns come up, if you're hearing things about suicide or self-harm, we definitely want to get other people involved. So we're going to do to finish up here, we're going to do just a few little scenarios, but I want to check in with any questions that anybody has first.
Yeah, hi, this is Tony. I'm pretty new, so please stop me if I'm missing something, but I didn't notice anything about reaching out to parents, and maybe especially for younger kids. And it seems like some of those conversation models are more towards that like tween to early teen kind of frame, where there might be a little more developed and even like being able to talk and articulate what's going on with them.
Yeah, absolutely. That's a good point. So you definitely, and I guess regardless of age, there's a time you definitely want to get parents involved. Anytime you reach out to kind of any other mental health, you'll want to let parents know that, hey, I've noticed these concerns and I'm connecting them with these mental health supports. If we're at a point where we're just like, I just want them to know I'm here for them. I know their parents are going through a tough divorce, or I know they're really struggling in school right now, but they have these supports and I just want to be a source that they can talk to. We have that. But to your point, Tony, if there are younger kids who maybe don't know how to communicate this or are struggling, then we definitely want to get parents involved sooner than later. And we can have these same conversations just with a parent. Hey, I've noticed your kid lately is really having a hard time engaging with the teammates, and they used to be really connected with them. And now he really doesn't want to show up, or he doesn't really want to be here. I just want to voice my concerns that, I'm a little concerned, and I want you to know about this. And if I can help guide to some resources, please let me know. You can also have those conversations and say, yeah, I've also let the school counselor know, just so that they're aware and can check in with him as well. So we can have kind of mirror these conversations with parents if and when appropriate as well. Any other questions or comments here?
Alex, one thing I might reach out to you maybe after this is just for some more resources remotely too. One thing that's come up recently, just that there aren't a lot of resources here in Steamboat for some of these challenges. There are some, and I think it's important that we have those, but I just from talking to the mental health professionals that are here in Steamboat, they acknowledge that there aren't a lot of resources here, and there's real high demand, and they're not able to meet that demand. If you might, a kid might have a challenge, and their folks could reach out to a counselor or a psychologist and they're booked out. So are there some virtual or remote opportunities and resources that you recommend?
Yeah, I'll send out, there are now a lot more remote options for people. And I'll send you a list. And then there's also, this isn't super helpful, but there are options in Denver for more severe, like kind of more inpatient, like Denver Springs is one that takes kids and teens. But I think it's important for parents to know, like, if their kid's in that big of a mental health crisis, that they have kind of these options that they may have to get to Denver for. But also like thinking about what insurance, covers, but a lot more resources to do telehealth now, which is great, right? That's a great option if we're needing it, especially if we're lacking resources. So I'll send you some of that when I send these slides as well, of how you can get connected. And I believe it's called Sondermind, can help find therapists, and whether it's through telehealth or local, and through your insurance as well. So that's an option, but I will send that out to you.
Great, thanks.
Any other questions or thoughts? Right. Well, just to finish up here, I'm going to do just one quick scenario that we'll do together, just to kind of put this all together. So Andre has recently moved schools and is getting to know his school and team. He has a great school record. His grades were well above average, and he was a star player for his previous team. Andre has been diagnosed with depression, but managed it well with support from family and friends and providers. Andre is now at a higher level of competition with the new school, and he's starting to feel overwhelmed by the pressures and intense practice. He's also feeling very lonely and does not know what to do during breaks when others are socializing. He confides in his coach that he wants to quit because he is too stressed out and does not feel like he is performing well. So thinking about what are his protective factors, or those safety nets around his mental health, anything stand out to anybody?
Yeah, hey, this is Tony. Aunt Andre seems to be pretty cognizant of his mental state.
Absolutely.
And that's the fact that he even reached out to the coach and is able to talk about what's going on is a great head start.
Absolutely, yeah. So he has great awareness of what he's dealing with. A lot of kids don't necessarily have that. So he knows he has a previous diagnosis. So he kind of knows this. Also that, yeah, he confided in his coach. So he obviously feels connected enough to his coach, or comfortable enough with his coach, to do something and to be able to reach out. So that is a great example of a protective factor. Another one here, right? He does have support from family, friends, and providers. Maybe that friends and provider are no longer, in the same spot, but he has created a network of support, or his family has helped create a network of support to help manage that a little bit more. So those are some of those protective factors that we can note. Anything that you notice of big warning signs here?
Not socializing. Right.
Kind of feeling a little isolated, making the comment that he's too stressed out and wants to quit. And feeling, a lot of pressure, right, with what he's doing. Anything that you would, if this was a kiddo you were coaching, what kind of next steps would you maybe do in this situation?
Probably talk to him and figure out what we can do to minimize his stress.
Perfect.
If it's the intensity of practice, or is it school? Is it both of them?
Yeah, absolutely. So even just saying, hey, you told me you're too stressed out and you want to quit, but I also know that you love this sport. You love practicing, you love playing, whatever it may be. So tell me, what can I do here? What can I help with, or how can we figure this out? What needs to change here? And the one reason I give examples like this is because a lot of times when we see a kid struggling or not doing well, we really hyper focus on the negative piece. But what can be helpful, like what Tony pointed out, is to also look at those protective factors, because those are ways as coaches we can pull from those and say, hey, you have great awareness of what you're dealing with, or I know you have really good support with your family and some of your friends in your hometown. How can we connect with them? So when we hyper focus on the warning signs and the negative and kind of all the bad stuff that we're noticing, we can kind of get lost in there. So when we can also look at, well, what does this kid have that's really helpful and really positive, and be able to pull from that, that's a way that as a coach, we can really support kids in what they're dealing with. All right, so that is all that I have. Does anybody have any questions for me? Any other questions or any other thoughts or anything they want to share?
I think one thing that I've been seeing a lot more of is a lot of anxiety at a much younger age, and trying to figure out how to deal with that with a 8 or 9-year-old as well as a teen.
Yeah, that's a good point. Yeah, it is tricky because we are seeing more anxiety just across the board. And like you said, with younger kids. And I think, if you're really noticing high anxiety, we definitely, as a coach, you don't want to be, trying to manage that all on your own. So it is important that parents have awareness that, schools, teachers, counselors, and also their provider, if they have one, to really kind of come at it from all angles to see how to best support that kid and what they're dealing with.
Alex, this is Tony. It seems like there could be pressure on sports as a little pocket of normal in this pretty abnormal time. And I think leading with some of the opening questions like, hey, COVID's really hard. We're having a hard time. We're not trying to pretend things are normal. This is something great that we love doing, but not trying to maybe make it as normal as it can be, understanding that for the kids, that it ain't normal. There's a lot of not normal.
Yeah, I think that's really important to do that. We want kids to know, like this isn't, this not a normal time, and things are weird and it's constantly changing, and it's not fun to navigate this or deal with what we're dealing with. Like, are we wearing masks? Are we not wearing masks? Are we having practice? Aren't we having practice? That back and forth and that change in routine is super difficult. And I think putting that out there for kids and letting them know that, yeah, like even as a coach, this is hard. I'm not normalizing that it's not normal, I think is helpful. And the more we kind of have conversations of some of the hard stuff, the more kids feel more comfortable coming up to us or talking to us about things that they may be having challenges with. Anything else?
Alex, I'd just share that big thing that hits home to me, having been an athlete, was the video about if this was a physical issue. And we can all, I think we've all, their coaches have been injured, so you can relate to that, right? If you haven't experienced mental health, I think that's the big barrier, because the go-to is, but you live in Steamboat, it'll be better tomorrow. And just, if you've never experienced it, how hard it is. And so this is really opening my eyes to that factor that it's a whole different ball game, and it's really hard to relate if you haven't experienced it. So just appreciate you spending your time with us and making us aware of this. And I think the timing is perfect, and this is a good thing for all of us to be aware of. So thank you.
Yeah, and thanks for sharing that. I think that's important. And you don't have to have experienced a mental health concern to be supportive or to empathize or to be compassionate to a kiddo. So I think, even just what you said there of, I don't know what you're going through, and I'm sure it's challenging. Can you tell me more of what you're dealing with? Like, that can go a long way. Being a little bit more vulnerable or even just a little bit more open. It doesn't mean you have to be an expert or know everything about it. That kind of realness that we can bring to some of these conversations a lot of times make kids a lot more open to be like, oh, okay, like it's not just another adult telling me what I should do. And so I think what you just said there is a great way even to talk to kids about this.
Great, thanks.
Yeah. Anything else?
Alex, thanks a lot. One question I have is, have you seen that kids are becoming more comfortable talking about mental health challenges? Is that something that's changing in our society? I think it's something that maybe some of us who are a little bit older, coming from a time when people didn't talk about these challenges, especially in athletics. I think athletics is a realm where mental strength is a real is something that's really valued, an attribute. And talking about struggling with that is something that people at least 20, 30 years ago were very uncomfortable with. I think there's still struggle with that. Are you finding that kids today are more comfortable sharing their mental health challenges or are more open to talking about with a coach or their parents?
I would say overall, yes. I think you're spot on that. Yes, this is definitely more of a conversation that we're seeing, but I would also say it depends on a kid's environment. So in a safe and comfortable environment, yes, we're seeing that a lot, but we still see some struggles with this in more rural communities in general. Also kind of mentalities where there's like, pull yourself up by your bootstraps. If parents aren't supportive, if school systems aren't, then there's still this kind of closed down kind of concern. So it does depend on, their supports and their environment that they're in, but overall, absolutely, there is more conversations around this.
That's good to hear.
Yeah. Absolutely.
Well, Alex, thanks so much for the great presentation and for your time. Very valuable. I think I'll reach out to you for some more resources for some of the remote, telehealth resources for kids and their families here. As I mentioned, there aren't enough resources here in Steamboat to meet the need. So that's something that could be valuable, and that we can add that to our list to provide to families and coaches if they encounter some challenges.
Absolutely, yeah, that sounds great.
Hey, Alex, that video that Todd cited was fantastic. Is that just YouTube?
Yeah, it's on YouTube. It's a BuzzFeed. If you just do BuzzFeed physical health versus mental health, it should pop up.
Great. Well, Alex, thanks so much. Have a great day.
Thank you.
Thanks for joining us here. And thanks everyone for hopping on and talking about this important topic.
Thanks everyone.
Thank you.
Bye.
Thank you. Bye.
Bye.
Thanks a lot, Alex. That was great.
Yeah, let me know if you need it. I'm actually drafting you an email right now with all this stuff, so you have it.
Great, appreciate that.
Yeah, absolutely. Well, we will be in touch. Let me know if you need anything else.
Sounds good. Have a great day.
Thanks, you too.
Yeah,
Bye.
bye.